Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
All right, welcome back. Now we're going to talk about another related issue, which is the stomach. We finished with the esophagus problem, what can happen, which is very common. Now we're going to move down a bit and we'll talk about the stomach. The thing that I want to talk to you about the stomach is the H. pylori. H. pylori is a bacteria that I think we have a picture of it. It looks like a snake, bacteria that looks like a snake, like you see branch in a snake or something like that. You see it right there in the images. So if we can look at the H. pylori. H. pylori is very common. It's very common in not only in Cameroon, but also, this is the H. pylori right there. You see, is that yellow thing there that look branching off. The H. pylori is an amazing bacteria. Amazing bacteria, what makes it unique is this bacteria lives inside the stomach. So you're gonna ask me, how it lives inside the stomach if you just said the stomach has a very strong acid called hydrochloric acid. And the pH, which is the strength of that acidity, is about 1.5. That is very acidic because the scale starts from 1 to 10. And I'm at 1.5. That's very acidic. And if it digests meat, why it does not digest this small bacteria there? I mean, it can destroy the bacteria. Normally, yes, if any other bacteria is being swallowed to the stomach, it gets killed. Except the H. pylori cannot get killed because this H. pylori is very smart. It protects itself by creating an alkaline medium around it, meaning it raises the pH, meaning make it more like 7, 8, so it alkaline the medium. Wherever it stays, it alkaline the medium, so it protects itself from the acid by alkalinization of that medium where it stays. Basically, it removes the acid from the area where it stays, and it makes that place a bit of alkaline. So you understand? So it protects itself from the acid. It lives in the acid. That's H. pylori bacteria. It lives inside the stomach. It lives inside the acid. So it's an acidic bacteria, and it cannot be killed easily. And it has a lot of symptoms that we will discuss right now. So if we have H. pylori, that is by definition a cause of gastritis or chronic gastritis if it stays for a long time, and that chronic gastritis may lead to peptic ulcer disease. So this is the H. pylori, the most common cause for making ulcers, for having you have chronic gastritis. What will be the symptoms? How do you know you have H. pylori gastritis or gastritis even without H. pylori? If you have gastritis without H. pylori, it's very easy to deal with. But if you have H. pylori gastritis, which is very common, then we have a little bit of a problem. What you're going to be looking for? You're going to be looking for belching. You always belch. Second, you're going to be looking for fullness. You're always full, even if you don't eat. You're always full. Third, and most commonly, you're going to be complaining of epigastric pain. Epigastric pain right here at the middle. Right here. That's epigastric pain. Now, if this H. pylori continues with you for a long time, it can cause chronic gastritis. And from chronic gastritis, we can advance to ulcers. And from ulcers, we can advance to perforation of the ulcer, and then we have a big of a problem. So we start with H. pylori, we advance to gastritis. From gastritis, we advance to chronic gastritis. From chronic gastritis, we can advance to an ulcer. From an ulcer, we can advance to perforation. This ulcer can perforate, and then you will bleed. And that is very nasty. That is emergency. Is this the only thing the H. pylori do? No. The H. pylori is a very bad thing to have. The H. pylori is a bacteria, and is the only bacteria in the world so far that can cause cancer, stomach cancer. A bacteria causing cancer? Yes. H. pylori can cause cancer, can cause a condition called MALT, can cause a lymphoma of the stomach, and can cause also adenocarcinoma of the stomach. Both types are cancer, stomach cancer. So H. pylori is not to be taken lightly. Sometimes you will have frontal headache all the time. That is H. pylori, if it comes with the epigastric pain. So you must have the epigastric pain. You must have the belching. You must have the fullness. These are all three main signs and symptoms for someone who have H. pylori. Now there are tests for H. pylori. There is H. pylori ELISA. ELISA is a machine that gives you accurate results, but you take the sample from the blood. I don't like that. I like the more accurate way to determine whether you have H. pylori or not, and that is the stools. I look for the antigen of the H. pylori in the stools, and that is the most accurate way so far to decide whether you have H. pylori or not. So if you want to do test about H. pylori, you ask the lab or you ask the doctor, Doc, I want to do it from the stools. I want to look for the stool antigen. That is most accurate. Sometimes you do it from the blood, even with ELISA, and it is not there. The antibodies against the H. pylori is not, it cannot be seen or detected in the blood, but yet it is in the stool. So in the stool, we're looking for a piece of the H. pylori we call antigen. We look for a piece of the H. pylori in the stool. The best, most accurate way to decide whether you have H. pylori or not is to take that piece of a stool and look for antigen. Look for the antigen of the H. pylori. Now we know we have H. pylori. So again, the symptoms start with a little bit of epigastric pain, fullness, and belching, and it then advances to chronic gastritis. And when we develop an ulcer, most likely you will feel the pain right in your back, upper back. And then you know you have a little bit of ulceration there. If you ignore it, the ulcer can go deeper and deeper and deeper into the wall of the stomach till the point that it can perforate, and now we have emergency. Okay, so now, like I said, I do not like to do endoscopy with anybody because endoscopy carries risk, and it is not recommended unless there is an indication for it. By the same means, I want to do endoscopy for this patient with gastric only if there is a little bit of bleeding. Then I need to do endoscopy to see the source of bleeding. Beside that, I will treat with medication first. So anybody who comes in with epigastric pain, if you have epigastric pain, a little bit of frontal headache, which is not necessarily in all patients. Some patients will have it, some patients who don't have it. Bulging and belching and fullness, that is the three most common signs and symptoms most of you out there complain of. And the first investigation that I need to do for you is to test for the H. pylori from the stools. Now, is H. pylori easy to treat? No, unfortunately. It's a very stubborn bacteria and very difficult to treat. We need a combination of multiple antibiotics to get rid of it. Meaning, they have what is called gastric kit. I get patients who take in the gastric kit for 7 days, and we test them. H. pylori is still there. So we have, in medicine, treating H. pylori, we have what is called sequential modality or sequential therapy, sequential protocol, whereby I treat for 10 days using 2 medication. Then I treat after this 10 days, I treat for another 10 days with more medication. So I don't hit the patient with all the antibiotics all at once. It will be a bit difficult on the patient to take. So I prepare the patient in the first 10 days to accept the following 10 days with heavier antibiotics. And after this sequential therapy, 99% of the cases H. pylori is gone. There's no more H. pylori. Now the second question will be, how did I get H. pylori? You got it from saliva. You got it from saliva. The mode of transmission for H. pylori from one patient to another patient is saliva. And how can I get contaminated by somebody's saliva? Well, number one, if you drink after this somebody from the same cup, or if you have an intimate relationship with that person and you kiss the person. Now we have transmission of the H. pylori from one patient infected with H. pylori saliva into the next patient. So if we have a husband and wife and we test the husband for H. pylori, we need to test the wife as well for the H. pylori. We also need to test the household for H. pylori. You cannot have H. pylori, even if it's a child, you must treat the child. H. pylori is not something that I want you to stay with, because H. pylori is nothing good about H. pylori except one thing. Yes, correct. There is something, well, it is not good. You have to kill it, but I need to tell you, if you have GERD and H. pylori, well, if you kill the H. pylori, the GERD, which is the heartburn, the gastroesophageal reflux disease, gets worse. Yes, because the H. pylori, like I said, produces alkalinity. It makes the pH a bit low. This is how she lives, by reducing the pH, okay? So it survives in the acid, and it even reduces the strength of the acid. So when I reduce the strength of the acid, and that is what H. pylori do, it will help me if I have GERD. So H. pylori is not all bad, but I'm just joking now. It's all bad, but it has one thing unique, especially in those patients with GERD. So if I have an H. pylori gastritis and I have GERD, gastroesophageal reflux disease, this H. pylori here will make my reflux disease better. If I get rid of the H. pylori, my reflux disease, the heartburn that I feel, will become worse. Does it mean that I leave the H. pylori? No. I cannot leave the H. pylori, because it can progress to a lot of bad things. Gastritis, ulcer, perforation of the ulcer, and possible carcinoma or stomach cancer. So I'm very happy to kill H. pylori and get rid of the cancer or progression into cancer. This is how this cancer is treated, by killing the H. pylori. And we said, summarize again, H. pylori is not easy to kill. It has to go into sequential treatment, 10 days, then followed by another 10 days. That is the best way to kill H. pylori. There is no better way to kill H. pylori than this.